Okay, good evening, everyone, and welcome to ATP Live. And I hope you can hear me, and I hope you can see me. If you can see me, if you can hear me, let me know in the comment section. For those of you who are watching on Instagram, thank you for joining me. I can see some of you already. Extraordinary, 24 Hills, Mimi Spice, all of you, you're welcome. And for those of you who are watching on Facebook, YouTube channel, you are also welcome. So please help us to share the video so that everybody can see us and they can hear us. Okay, so I'm also going to do the same. So ATP Live is a program where you can ask any questions that you have about your children's health issues within the next 1 hour, and I will try and answer them in the next 60 minutes. However, don't worry if you are unable to ask your question live. You can always post your question on Ask the Paediatrician Facebook groups from Mondays to Saturday, and our professionals, our doctors, our moderators, they'll be there to help us answer your questions. So, but we like to do the live session just once a week, every Monday, and you can watch it on Facebook, on Instagram, on YouTube. And if you want to watch even the past episodes, you can also go to all our social media platforms and you can watch the program there. So thank you so much everyone for joining us. Thank you, Facebook people. I can see you joining us right now. So let's just use the next a couple of minutes to share the video. Let's make sure everybody can see us and everybody can hear us. So let's all just share the video right now, and then after that we can now start to answer our questions. So share the video, please, pretty please, so that I don't want some, oh, I didn't know you were live. Why did you go live? So to avoid those scenarios, so we'll just try and share the video now to all the platforms, and so that everybody can see and everybody can hear. I'm trying to do that right now. But if you have any question, feel free to start dropping your question straight away, so that I will be immediately I finish all this sharing on all the platforms, we can start to address the questions straight away. So the earlier we get the questions, the faster we can answer them, and then we can go on to other, we can take as many questions as possible. So last week I was not here because it was Easter Monday, and I hope you all had a wonderful Easter. Happy Easter to all the Christian faithfuls, and for the Muslims, happy Ramadan as well. I know we're rounding up very soon. All right, so welcome everyone, and we can, I think I've done all the sharing now. I think I'll just make sure they are all pinned, and then we can all start. So if you are watching me on Ask the Paediatrician's Facebook group, you can just drop your questions straight under the video. And if you're watching on Instagram, you can drop your questions straight under the video. However, if you're watching on other groups like ATP Family or ATP Still a Mom or FTM groups, those groups you have to click on the video so that you can get to the real page and drop your questions. If you just drop your question under the link share to the group, I won't see your questions. So please make sure you click on the video itself and drop your question. If you're on ATP Family, ATP Still a Mom, or FTM Facebook group, but if you're on ATP group proper itself, Ask the Paediatrician Facebook group, or you are on the Instagram or YouTube, you don't need to do that. If you drop your comments straight under the video in those groups, I will see them straight away and I can answer them. All right. So I think, I think we're ready now. And I can see all the questions. Okay, let me just check the Ask the Pediatrician also has it pinned. Just one more minute. Okay, no, I've not pinned it on ATP proper itself, which is all right. Okay. So we're done with all the sharing and all the pinning, and then we can go straight to your questions. All right. So I'll start with Instagram people. They are the faithful people that always come early. So Major Evans is the first question I'm saying here. Say, good evening, ma. Please explain more about sickle cell in children. Okay, if you ask those kind of questions, I need to give you a lecture, and that's going to take the whole 1 hour. I can talk about sickle cell anemia for 1 hour, but what I think I would do is that I would do a ATP hour session on sickle cell anemia. June is actually when we celebrate this World Sickle Cell Day. This is still April, maybe that may be too long. Well, I promise I will try and do a whole ATP hour session on sickle cell anemia, because that is actually when we can talk in details. So if you want, so usually on Thursdays, I actually do a teaching where I take one topic and talk about it for 1 hour. So we have enough time to talk about it. So you may want to follow my podcast on Ask Dr. Gbemi ATP podcast or our YouTube channel, or listen to Fresh Waves Radio. You can, that is when I do a whole 1 hour kind of teaching, which is the kind of question you're asking. So asking me to talk about sickle cell is not a 1 minute answer question, it's an hour long discussion. So if you are, but let me just give you a summary. If you have a child with sickle cell anemia, your child needs to be registered in what we call sickle cell clinic. We have sickle cell clinics in all the teaching hospitals, almost all the general hospitals, especially in Lagos. I don't know about other states. They all run sickle cell clinics. Or if you go to Sickle Cell Foundation, they have a very big building opposite Lagos University Teaching Hospital in Lagos. Or just go on their website. They have a list of all the sickle cell clinics in Nigeria. So your child should be registered in a sickle cell clinic, and your child must be attending that clinic regularly, because there are regular medication that we give to children, like folic acid, paludrin. We have to give them every day. They need to take a lot of water. So we need to prevent malaria. We need to prevent infections from what we call pneumococcal bacteria. So all these are cares that we do for the children routinely. And if the children, depending on some children, if their PCV are low, sometimes we need to give them some drugs, that can help. Sometimes for some children, we need to exchange the blood regularly if they are at risk of having stroke. So these children require lots of care. So they are not something you can just sit at home and do by yourself. They have to be seeing the doctors, the pediatricians, who take care of them regularly. Usually we see them like every 3 months. There are even sickle cell clubs for the children, and when they have crisis, you need to know what to do, where to go, and sometimes you must have some painkillers yourself at home that you can start with. So the most important information I'm going to give you today is to go and register that child in a sickle cell clinic. If you tell me where you are based in Nigeria, I can give you an idea where to go. But notwithstanding, if you go online, just Google Sickle Cell Foundation, you will come across all the list of those clinics, and your child must be registered with one of them, and you must attend those clinics regularly and make sure you give the child all those drugs and lots of water every day. So I will stop with that, because like I said, it's an hour-long discussion. But watch out, I'm going to do a whole teaching on sickle cell anemia, because it's the most common genetic condition in Nigeria. 3% of all Nigerians have sickle cell anemia, or 25% of us carry the S gene. So it's quite a lot with us. So it's most common is our own cystic fibrosis, like the Caucasian, sickle cell is our own cystic fibrosis, our most common genetic condition. So everybody needs to know about it and how to prevent it more importantly. So we'll come to that, but I will try and do a topic. And when I do that, we'll share the flyer so you will know, and you can check it on my podcast or on our YouTube channel. Somebody's asking a question: Has what age must a child start talking? Most children start talking at the age of 1 year. So 1 year, 1 word. So I usually teach parents what I call the rule of the thumb. 1 year old should have at least one single words. Okay, a 2-year-old should be combining at least 2 words together. Must be combining phrases. So a 1-year-old may have one word, maybe mommy, maybe amen, maybe hallelujah, maybe their favorite person in the family, name of a brother or sister. They must have at least 1 to 3 words. A 2-year-old should start combining words together, at least 2 words together, things like mommy, biscuits, that kind of 2 words together. A 3-year-old should be speaking sentences. 3-year-old should be combining at least 3 words together with action word. I want water, I want bread, something like that. So that is what you expect for a 3-year-old. A 4-year-old should be speaking like an adult. Everybody should be able to understand what a 4-year-old is speaking with full correct grammar and everything. That is what we expect for a 4-year-old. So if your child is not doing any of these things, you must see a speech therapist. Sometimes you may also need to see a pediatrician, developmental pediatrician like myself, but your child needs to, and please don't let anybody tell you, oh, your child is being slow, oh, boys don't talk early, oh, this and that. Don't rationalize, okay? It's better to go to the hospital and for us to tell you, okay, don't worry, than for you to come and we say you're wasting time, you've delayed long enough. So please, if your child is not talking, not following those rules of the thumb I just said now, 1 word, 1-year-old, 2 words, 2-year-old, 3 words, 3-year-old, 4-year-old, speaking like an adult. If your child is not following that rule, you must see a speech therapist immediately. All right. Somebody said, okay, major advice, your child has been transfused 4 times and she just turned 1 year. So if your child is being transfused, I want to assume your child is with where is the child being transfused? Okay, let me start with that because sometimes people get transfused anywhere. I hope your child is going to a teaching hospital, all right? So you must go there because it is not every low PCV with transfuse in a child with sickle cell anemia. So your child should be seeing a pediatrician minimum, pediatric hematologist especially. So please see one of them. Sometimes your child is a child that is breaking down red blood cells so often, we need to give them some other drugs, that can help with that. So please make sure you are seeing a pediatrician in a teaching hospital. Anadu Chisholm, good evening, ma. Is there, give me water. Is that comfortable? Is there something wrong with a child 2-year-old who haven't started talking? Okay, I think I've just answered that question. I think it's clear now what you expect. So I hope you had that. So because that's exactly what I just did now. Your child, if your 2-year-old is just saying how many words, you didn't tell her, say bye and call some words, but not always. So if your 2-year-old is not talking, your 2-year-old should have nothing less than 20 to 50 single words of vocabulary, and they should start combining words together. So if your 2-year-old is not having up to that, that is speech delay. You definitely need to see the speech therapist. Okay, so I think I've answered your question, Chisholm, because I think I've done the details. All right. Okay, your child is in this premier hospital. Yeah, I think that's a good private hospital, and I think they have pediatrician here. So just have this conversation with them. Okay, have that conversation with them. Let them know what your concerns are. Okay, still the same question. I've answered that. So your child should be on folic acid and all that, and your child needs to be protected from having malaria, things that are breaking down the red blood cells and all that. So It's not just enough to be getting transfused all the time. If you are not comfortable, you may want to go to National Hospital Abuja if you're in Abuja, but it is because sometimes private hospitals, depending on how often the pediatricians are there and all that. But if you're not comfortable, you want to go to a government hospital, you can go to National Hospital Abuja. I'm sure they will have a very lovely sickle cell clinic there as well. All right, so I think I'll take a break from Instagram and I'll go to Facebook. Say thank you, doctor, for all you do. I'm unable to post my question on all the platforms. If you're unable to post your question, that there must be something wrong. So you must be our member on the group. You're a Facebook user, so you're on our group. But remember, you can only post from Monday to Saturday. Some of you will still always try to post on Sundays. You don't read the group rules. The group, you cannot post on all the platforms. You can only post on Ask the Pediatrician Facebook group. And when you want to post on our group, there are rules you need to follow, okay? So make sure you follow the rules. You can't post on Sunday. So if you've been trying to post on a Sunday, you won't be able to post on a Sunday. You have to post from Mondays to Saturdays. That's when the groups are open for that. And when you post, please follow the rules. Keep your questions straightforward. Make sure you don't put pictures of trying to do adverts. Some of you try to do sneaky adverts, and we're also very aware of that. So is this particular brand of bed or formula or something good for your child? We don't need a picture of that brand or formula to tell you the answer. So if you put those kind of pictures, we are going to decline it. Some of you put pictures showing genitals of children. We can't do that. So if you can't ask a question without showing the pictures of a naked child, we're not going to accept that kind of question. So if you go through our group rules, you will know what is acceptable, what is not acceptable. If you don't break our rules, we will always accept your questions and we will answer them. When you post, there's always a timeline for us to approve. Okay, for example, now I'm here live and I'm talking to you all. So there's no way I'm going to be answering questions when I'm live right now. So some of you post questions, you want answers straight away. You know, you're not going to get that. So we always say that anything that cannot wait, don't post it on our group. Take it to the hospital. We don't do emergencies. We don't do now. No, we can't do that. All of us work. All of us are volunteers. So we have our full-time job. So we do ATP work as a voluntary work on our spare time. You need to understand that and you need to appreciate that. So if you want something urgent, no problem. We are also in the hospital as well. So you come and meet us in the hospital and we can do the urgent. But if it's just health education, if it's just information, those are not emergencies. Those can always wait till 24 hours, 48 hours. We try to answer and because we have different volunteers, we are all in different time zones. So people are always answering questions 24/7 on our group. So our moderators can always answer the straightforward everyday questions, but there are questions that somebody like a professional has to answer. So if you put in a picture, a video, I have to see it, or one of our doctors have to see it to answer it. So if you want to answer a very straightforward question, don't put in pictures and videos for unnecessarily. Just go straight forward and ask your question because somebody can answer that. But if you want something that is more very technical, a pediatrician has to answer that, and that has to wait. So if you have something that is urgent, please do not post on our group. If your child is convulsing, don't post it on the group. If your child has a burn, your child has a fall, if your child is unconscious, those are what we call do not ask online questions. These are hospital. Anything that is immediate, you have to go to the hospital. Anything that requires intervention, you have to go to the hospital. And we don't really want you to be posting about sick, like your child is sick, what do you treat the child? We're not going to treat your child online. We're not going to set up a line on the child who is vomiting, having diarrhea on the Facebook. That has to go to hospital. So we expect parents to also use common sense to know these are the things I should post online, these are the things I should take to the hospital. We can advise you. Sometimes we say advice, oh, this has to go to the hospital. But we expect you, you are all very sensible parents. We expect you to know what to go to the hospital for and what to access online. Our group is for health education, information. It is not an online hospital. It is just to advise and to, educate you and to prevent those illnesses. But once it happens, and you have to come to meet us in the hospital as well. So I hope that is helpful for those who may have issues with posting on the group. All right, God bless you too. The next question, My 7-month-old doesn't like to suck breast for long, just 5 minutes and she's done. It's okay. She likes her pap and cereals with milk, and she hardly cry when she's hungry. Is it okay if I feed her every 3 hours? It's not necessary for you to feed a 7-month-old who is on complementary feeding every 3 hours. And usually, when children are older, they tend to suck. The duration of sucking is less because they are more effective in sucking. So don't expect that they will be sucking for long, like when they were newborn. So when they are newborn baby, they are still learning to suck and they don't have as much strength and all that. But as they get older, they are more, effective suckers, so they can drain the breast very quickly. And when you start complementary feeds, make sure you are not replacing breast milk with complementary feeds, which is what you do. If you start giving complementary feed every 3 hours, that is too much. Your 7-month-old only needs to take complementary feeding twice a day, not more than 3 times a day. So that is very important for you to know, because otherwise you're going to replace breast milk with complementary feeds. You really need to go to our guide section on complementary feeding. We have guide 2 on complementary feeding. There are videos there. Please, when you watch these videos, pay attention to the information. There is information on how often you should give those food, what quantity you should give. Those are very important information. People don't pay attention to it. Some of you are looking for the recipe of the food that you're going to give. No, the principles are what you really need to follow. The principle: how often should I give my baby? How much should I give a 7-month-old? Those are the things that are important. How do I combine it? So for a 7-month-old, the baby needs to only take cereals or pap just twice a day. And it should not be only cereals and pap all the time. So there are other food that your child should say, because the challenge with this method now is that after a while, it's only cereals. The child doesn't eat other food. Then we're going to have problem when the child is 1 year old. The child only still wants to be taking cereal at 1 year old, when we expect them to be taking exactly what the family is eating. So there must be variety. Everything is not pap and milk. Everything is not cereal and milk. All right. And please, the quantity and the frequency is very important. If you are doing too much of complementary feeds, then you are actually weaning your baby off breast milk. So you really need to understand that we don't want you to wean your baby off breast milk. Your baby should still be taking as much breast milk as they were taking when they were on exclusive breastfeeding. When you start complementary feeding, you are only adding the complementary feeding to the breastfeeding. So don't give too much of the pap and the cereals and all that. It's just 2 to 3 times a day, about half a cup each time, and the rest of it should be breast milk. So if you follow the principles, your child will be sucking breast and all that. So don't give her pap and cereals every 3 hours. That is wrong. That is winning. There's some of you will now come and say, oh, my baby stopped sucking breast at 7 months, stop sucking breast at 8 months, because you have effectively replaced breast milk with complementary feed, which is actually not the right. It should be the other way around. Maintain your breastfeeding the same way you were doing before, and add the complementary feeds. And as baby gets bigger, then the quantity increases, and all those details are in the guide section on our Facebook group, Guide 2. And all those videos are very helpful. So I will encourage you to watch them again with a fresh eyes, with the concept of how often should I feed my baby, what quantity should I give. They always summarize, even at the end, they still summarize it again, so that you don't miss those important points. And try other food. There's potato, there's the same food you eat, your swallows, your ewedu, your okra, everything. That's all your baby should be eating. So it's not just pap and cereals. No, that is poor form of feeding the baby, and it's not good enough. All right. Somebody is asking, what is the relation between autism and not breastfeeding? There's no relationship between autism and breastfeeding and giving baby food. So there's no relationship. Why is autism so rampant? Well, autism, number one, we think there's more cases of autism. Number two, we think we are actually more aware. It's not as if we don't have autism before, but people don't know what autism is. So people just lump all the children with special needs together, and people don't know how to diagnose them. So a lot of children with autism, people don't know. They just think they are intellectually disabled or whatever. But nowadays, everybody is more alert and more aware. So I think that is why and people are recognizing children with autism earlier. And number two, I think generally we're having more cases of autism. We don't know why, but that is what is happening. The cases keeps increasing, but it has nothing to do with breast milk or breastfeeding or formula. I know there are lots of theories. People believe in some gods, infection, but those are not evidence-based information. We think autism is something genetic, and we think there are some environmental factors, but definitely not breastfeeding or no breastfeeding. All right. Somebody said my granddaughter's liver is becoming big, but you didn't ask any question. You have to ask specific questions. I don't know what you want us to do with the big navel, but usually big navel means the child has what we call umbilical hernia. It depends on how big it is. Some of them we just leave it alone. As the children gets older, it will get smaller. But if it is really big and it's causing pain or obstruction and all that, you have to see a pediatric surgeon and then they can operate it and repair the hernia. It's not a big surgery, but it's still a major surgery. So for most children, if it's not disturbing them, we just leave it until they're about 5. And by then, we expect most of it to have resolved. But if it has not resolved or it is causing problem, like the child is crying from pain, when you try to press it down, it is not going down, it's hard, then that is complication, and that is when the surgeons will have to operate it. So that, but otherwise, if it is small, had not disturbing the baby, just leave it alone. Just leave it alone, all right? Somebody said, good evening, my baby's skin is peeling, especially her knees and finger. Okay, if your baby's skin is peeling, the first thing we want to be sure is that you are moisturizing the baby's skin very well. You're applying moisturizers. So there are lots of, like your Vaseline Blue Seal, like your shea butter, like your olive oil, coconut oil, those kind of products that don't have too much perfume. You can just make sure you apply it, and it's not just once a day. You apply it several times a day, because peeling skin may just be dry skin, or it may be that some children just have dry skin, or they are changing their skin. So just moisturize. But if you're doing all the moisturizer and the skin is peeling or the color is changing, you may want to see a pediatrician or a dermatologist in case it's something else, like atopic dermatitis, because of the areas you mentioned and all that. So you may want to see your doctors for that. All right, I'll take this question, then I'll go back to okay, I don't have any more questions on Instagram for now, so I'll just continue with Facebook. Somebody said my 2-year-old learns fast. It's in PG1, read is 2 times stable, 2 letters, 3 letters. Do you think it's being taught too much? To be honest, I'm not really worried about whether your child is being taught too much or not. If the child is learning, fine. But I just don't want you to be putting pressure on any other 2-year-old who is not doing that. That is where we can fight. All right. So the most important thing is a 2-year-old just needs to play. They don't even need to be in school, honestly. They just need to play with other 2-year-olds, go to play groups, learn to play with their hands, learn to recognize the environment, learn to smell the roses, learn to just play, learn to interact with other people, speak. Those are the things that we want from your 2-year-old. So that is what I want. I'm not worried, but if you're 2-year-old, some children are geniuses. So maybe your child is a genius, who knows? No problem. So I'm not worried, but I don't want you to be putting pressure on a 2-year-old or forcing them to read 2 times table or forcing them to do this or do that. No. Just let them play, let them be happy, let them just enjoy. They don't have any business doing any homework or schoolwork or anything. They just need to play and play with mess, Play-Doh, all those kind of play, develop their fine motor skills and all that, course, do craft. Those are the things they should be doing at 2-year-old, not trying to cram 2 times table, cram ABC or write 1 to 100. It's unnecessary, okay? It's unnecessary. All right, so Glory is Olubajo saying, good evening. My preterm baby is 3 months, 3 weeks corrected. She's yet to have a stable neck control. Baby birth weight is 1.12 kilos. So for preterm babies, I always like to know your the gestational age when you had your baby, and let me do the correction myself. I always like to do it myself. So your baby was very small, your baby was very low birth weight. So your baby should be under a pediatrician. So the pediatrician who is supposed to be seeing your baby should be the one deciding whether the child has any developmental delay, depending on what are the challenges your baby had in when the baby was born. How long was the baby in the ICU, in the neonatal intensive care units? How long did the baby have severe problem like jaundice, like sepsis, like meningitis, apnea? What are the challenges the baby faced in the newborn intensive care? That's why the babies need to be followed up, because the pediatrician will manage that baby in the newborn period. We know what to expect, and or what to expect in the future. So, but usually we give them some allowances. So if your baby is corrected is 3 years, 3 months, 3 weeks, I'll still wait until 4 months. And if baby still doesn't have neck control, because you say stable is, does the child have neck control or not? That's actually what we really want to know. If by 4 months your baby does not have neck control, definitely we are worried about that. It's possible it's part of the prematurity. What are the challenges baby had as a newborn? So your baby needs to be under the care of your pediatrician for follow-up. So if you are not following up with a pediatrician, you need to be going back to the pediatrician for follow-up, and then they can monitor the baby. If by 4 months they are still worried about neck control, then we may need to start looking at, this child going to develop cerebral palsy? Do we need to get physio involved? Do we need to do this and do that? So, but that is the job of the pediatrician who knows the baby from the beginning, and we're supposed to be following up your preterm baby. So please make sure you go and be seeing that pediatrician. It's important. Many of you who have preterm babies, immediately we discharge you from neonatal intensive care, you always think that is all, is hooray, let's just go, and you don't come back. Very dangerous. The preterm babies are still very fragile, and they are still very vulnerable. So even when you go home, that is not all. And it is not just about them getting bigger, and most of you focus on the weight. You want them to be big, big, big. Let them quickly feed them formula everything so that they can be big. No, that's not the focus for preterm babies. The most important thing for preterm babies is the brain, because that brain was very fragile. If ordinary carrying them or handling them, they can bleed in the brain. So we need to monitor them closely. We know they're at risk of all these developmental issues. We need to monitor them. We need to monitor their development. So when you are discharged home with a preterm baby, please don't go and sleep and think you don't need a pediatrician anymore. You still need a pediatrician until your baby is 2 years old, before we are comfortable that there won't be any problem. So you must always see a pediatrician, nothing less than monthly or every other month, until they are 2 years old, until we are all comfortable that all the challenges of prematurity has been overcome. So please, this is just a general appeal to all those who have preterm babies. When they discharge you, ask for, when are you coming back for follow-up? Ask and make sure you attend, and you keep going back until they say, okay, we no longer worry, we want to discharge your baby. And the minimum is 2 years. Some of us do it up to 5 years. The minimum is 2 years. If you are going to a hospital where they don't follow up preterm babies, go to a government hospital and let them follow up your baby. I know some private hospitals and some hospitals don't do the right things for whatever reasons, but the most important thing is that you know what is right, what should be done with your children, and what you need to do. So please make sure you're seeing that pediatrician. Okay, the next question, was speech delay see a therapist or wait it out? Okay, this is a very funny question. Okay, I will tell you what, you don't wait out anything, because in developmental pediatrics, we have what we call the concept of early intervention. Early intervention means when we do something on time, a stitching time, like they will say, saves 9. When it comes to the brain of children, their brain is what we call plastic. Okay, so when the brain is one organ in babies that is not fully formed at birth, okay, the brain is still developing. So when a child is born, the brain is just about 70% developed. 95% of that brain development is going to happen in the first 5 years of life. Okay, so if there's any problem in that early years, the earlier we start intervening, the better, because the brain is still plastic. If you want to do more research, go and read about neuroplasticity. In other words, you can still do a lot of adjustments and modification, because what you stimulate in the brain will develop better than what you don't stimulate, because that brain is still developing. So what you stimulate, there will be more what we call connections, synapses will be forming more, and the brain will adapt. But if you just leave it alone, what is not stimulated, that part of the brain just goes dead. So early intervention works. So in United States, in most places, we are not interested in the diagnosis. We are not interested in, oh, is this child just being slow? Or does this child have autism? Or does this child have learning disability? The most important thing, focus on the issue. So it's better even if your child just has speech delay that is going to just be catch up later. Maybe the child just a low, slow developer or something like that. That you don't lose anything having speech therapy. You rather gain, and so the child will do better than for you to say, okay, oh, let me just wait this out. What are you waiting out? What if the child doesn't progress? What the child is, how do you know that the child is going to progress or the child is not going to progress? Doesn't make sense. So you start doing something and then you see. So if you start doing something and the child does better, all the pediatricians, all the speech therapists will be happy to say, we are happy with your child, goodbye, and don't come again. Then for you to come to us when your child is 5 years old and no word, or because you've been waiting it out, which is what some parents do. And then we've lost that period of neuroplasticity, we've lost that period of early intervention, we've lost all those interventions that could have helped the child. So you will notice that children can learn languages. A child who is 3 years old, they can learn 4 languages at the same time, if that is all the languages being spoken around them. But you as an adult, is going to take you more work to do that, because the brain of a child is more plastic. And so whatever stimulation is going to that brain, is the child is going to respond better. But for you, once you're an adult, your brain is a little more difficult. So you have to put more effort to even learn any new skills compared to a child. So there's a concept that when we delay, it works compared to when we delay. So you don't wait. If your child has a delay, go and get help. Don't worry about the label, whether it's autism or speech delay or this, just get help. And that's more important. Even if the child is a neurotypical child with no diagnosis, the child has not lost anything. The child has gained a lot compared to you watching and waiting, and then will come to us when your child is 5 years and down, the child doesn't even have any single word. It's going to take more work to even get the child to speak compared to if we have started working with that child from the age of 2 or 3. So all the advanced countries, US, UK, they have all these initiatives about early start, early intervention, and it's not diagnosis or label based. It's about intervention, early intervention. Doesn't matter what is causing it. The child is delayed. Let's work on it. That's the most important thing. So please don't delay. Make sure you get your child help, and the earlier the better. I know that the challenge in Nigeria is that we don't even have the help, but you as a parent, I would say you are your child's primary therapist or help. And if you want help, you will get it because you will look for it. And nowadays with technology online, there are therapies online, there are resources on YouTube you can watch and you can practice, because there's nothing magical about these therapies. It's about knowing the principles or the strategies and just do it with your child. And that is helping your child. There are lots of videos on how do you stimulate language development in child. How do you play with child? Some of you use cartoons and all this to babysit children who are not talking. You are not helping them. They need interaction, not with a device that is not going to give them that feedback. And that is why we say no screen time before the age of 2 years. Let them interact with human beings. Let them learn to interact with you. Let them play with you. You need to know how to use the right word. You can't be speaking a sentence to a child who doesn't have a single word. You have to speak, you have to bring down your own language to their level. You have to give them choices. You have to use all those strategies. That is what the speech therapist is going to teach you. So you can also do it with your child. So there's nothing magical about therapists, but they help the child because you're stimulating their brain, and then the brain is working, it's adapting, and the child will do much, much better. Somebody say, which hospital do I practice? Okay, so I don't think you can find a hospital which I practice. The most important thing is just go to, if depending on where you are, we can always direct you because would you know which part of the world I am? Depending on where you are, we can always direct you to there are pediatricians all over the country and all over the world. But for we run ATP clinics, and I think you can see our WhatsApp contact somewhere. You can always okay. Yeah, let me put that link. Let me put the banner there. Maybe it's not showing. Yeah. Okay, if you look at the banner running now, you will see all our contacts, including our WhatsApp and all that. So if you want to contact us privately, yeah, you can do that via ATP clinics. All right. Somebody say, my 8-year-old has been complaining of penis itching, no other symptom could be the problem. We won't know what is the problem until we see this child. So you know, it could be worms, it could be rashes. You know, you didn't tell us what is there. You know, it could be even the fact that the pants maybe they need to be changed frequently. Some of you wear all these silk pants and all that polyester pants. They are not very good because there's not enough circulation around the genitals, the perineum, the private parts of children. So wear cotton pants. Let children learn to change their pants. Sometimes you think they are 8 years old, they can clean after themselves. Sometimes you need to monitor them. Some of them are not very, they just want to run away quickly. So they are washing their cats. So they don't clean up properly. So you may need to watch, make sure the child is doing that. It could even be that the what's called the toilet roll, whatever the child is using to wipe. Some children are allergic to them, so you may need to check. Maybe it's that. Maybe they just need to change to water instead of using toilet to use water. So those are the things the doctors are going to ask you when you see them to know what is likely. And of course, they have to examine the child to say, are there rashes there? Are you deworming the child regularly? Because sometimes some worms can come out from the anus and move forward and cause itching and all that. So if you are not sure which one is the issue here, please see one of my colleagues, see a doctor. They will take you through all these questions, from the pants the child is wearing, how often you are changing it, how is the child doing the cleanup after using the toilet, any worms, any rashes, We will go through all those possible causes, and then we'll be able to deal with it, and make sure they're also not wearing something too tight around the area, something that can allow hair to blow. Some of you wear all these very tight jeans for boys. You need some hair flow around the genitals. So let them wear things that allow a lot of hair flow around that area and all that. It may be as simple as that. It may not be anything medical jargon. It may just be as simple as all those, making sure they wear freer clothing, cotton pants, change frequently, wash frequently. Maybe it's a toilet roll you need to stop and use water instead, and they clean properly, they warm them properly. That may be hard, but if you do all that and there's still no solution, of course the doctors can help you with that. All right. Somebody said my sister's baby 2 months old has this white discoloration of the skin. She was visited the hospital, was given antibiotics. Usually when a child has like discoloration of skin, it's very unlikely to be a bacterial thing. It's more likely to be fungal. So the kind of hospital you take babies to matter. Some people they are not experienced in doing things like that. So like if I say a child with white discoloration, just from the way you wrote it, I'm surprised that child was being given antibiotics, because that sounds like the child that needs an antifungal product. Anyway, please go and see a pediatrician, all right? See a pediatrician for proper evaluation. For children, preferably take them to pediatricians. Don't take them to all these general doctors, because sometimes they may not be very comfortable or conversant with how to manage children. So 2 months old baby, pediatrician place and all that. Especially the baby is also having patches on the head. That sounds more fungal. That doesn't sound anything bacterial at all. Bacteria is when you start seeing like pus, boils, and hair or wound on the skin. But when you see color changes, dry area, patches, that sounds more fungal. I'm not saying you should not become an expert in making diagnosis. That is a doctor's job. So, but take the child to see a proper doctor. You may go to a teaching hospital or a general hospital. Some of those hospitals, some of you don't like going to government hospital because I know you have to queue up and all that. But the good thing is that you are more likely to see the experts, the specialists in government hospital. You are unlikely to see a fake doctor in government hospital because the process of getting doctors into government hospitals is more thorough than private hospital. Anybody can be there. So you have to be careful. So if you're not sure, just go to government hospital, endure the waiting, the queue, and all that, but you're likely going to get the right treatment. I can assure you of that. Okay, Sharon is saying, good evening. My 2-month-old baby has tears in her eyes a lot, even when she's not crying. Okay. So she's tearing. That's what we call that. Sometimes maybe normal, sometimes it depends on how bad it is, really. I would just say just wipe it and look at it and leave it. Okay, you've gone to you've gone to a high hospital, the nurse, you shouldn't be seeing a nurse at the high hospital, you should be seeing the ophthalmologist. Yeah, so go back and see the ophthalmologist. At least the ophthalmologist have seen the baby and she is not worried, then I will not be worried. I'm actually not so worried about it because some babies do that. But just because if it's something that is a lot, then we wonder whether there's something else like a condition that has to do with the tear gland or something. So I really want an ophthalmologist to see this 2-month-old baby first, not a nurse. And when the ophthalmologist have seen the baby, whatever the person says, that's right. So go back until you see the ophthalmologist. When you go back, say, I want to see the eye doctor, not let them give you the dates and the appointment to see the eye doctors, or refer you to another hospital where you can see the eye doctor. That's the right person to say. All right. All right. I think this person who is posting about this discoloration of skin, please, it's okay now. You posted it like 3 times already. We've answered the question. Thank you. Somebody say, if baby of 15 months that say a few words, but don't wave to say goodbye. Is this something to worry about? Yeah, 15 months old should be waving goodbye. So if a 15 months old is not waving goodbye, I'll be worried. Is the child also pointing? Is the child playing with other children? Those kind of things. So you have only mentioned 2 things. See, that's the issue. Parents, you focus on 1 or 2 things. There are many other things that professionals are looking out for. Backing up to the person who asks, why do we need to go to speech therapy? Sometimes parents, you're focusing on, my child is not talking or the child is only saying a few words. But when a professional sees your child, they are seeing so many other things that you don't think it matters, but it matters to us. So that is why you should still see a specialist. You should see the speech therapist or the pediatrician, because when we see your baby, then we can tell you, oh, we are not worried. Okay, let's give the child time. If we are the ones telling you that, then hey, you are more relaxed. But when we see the child, there are many other things we'll start seeing, then we'll start telling you, what about this, what about this? And that is when you will notice, because you didn't notice before, because you are not thinking about that. You are only focusing on the part that worries you. So I would recommend you to see a doctor. Sometimes you may want to wait until the child is 2 years old, because sometimes we just give them a little time to see whether they are just going to catch up. But from 2, any of these things are not present, you must see a speech therapist. All right, let's go back to Instagram so that they won't get upset with me. All right. Instagram, where did I stop? Yeah, somebody, okay. All right, yeah, okay, yeah, major heavers. Okay, so they already had a penicillin. That's a good one. They're giving folic acid. I think they're treating your child well. Unfortunately, when it comes to sickle cell anemia, there's what we call different phenotypes. In other words, 2 children can have sickle cell anemia and they will behave this different way. So you have somebody who has sickle cell anemia who never even know they have sickle cell anemia, who never even went to hospital. There are some women, the first time they know that they are sicklers is when they go for antenatal clinic. In antenatal clinic, we will do all your blood genotype, blood group, we will do it routinely. That is the first time some people actually know that they have SS genotype because they've never been sick, they've never had crisis. That is one group of people. But you also have a group of people that every week they're in the hospital. So sometimes it's difficult for us to know who is going to be who, but we know we have some factors like those who have hemoglobin health and all those things. So, but I guess your doctors are doing all that. And sometimes for your child that is having this kind of frequent anemia, we may have to push on things like maybe hydroxyurea and all those kind of stuff. But I will leave it to your pediatric hematologist to discuss that with you. You can also read, if you go on our Facebook group, we have a group discussion already on sickle cell anemia, which you can read, but I'm going to do another talk on it anyway, so don't worry. I will let you know when we do that. Mimi Spice says amoxicillin and coamoxiclav the same thing. They are not. So amoxicillin is one antibiotic. Coamoxiclav is two antibiotics made up of amoxicillin and clavulanic acid. So there are two of them in coamoxiclav. Of course, amoxicillin is in both of them, but one is just amoxicillin alone and one is amoxicillin plus clavulanic acid. Please do what your doctor asks you to do. If they prescribe amoxi for you, don't go and buy coamoxiclav. And if you go to to all this our pharmacy, if your doctor has prescribed drug A and they will tell you, there's no drug A, but you can try drug B, please tell them no. Because some of these our pharmacies, some of them, the people there are not pharmacists, okay? They are just sales boys and girls. I know what I'm talking about. And some of them make terrible mistakes, because some drugs, especially injection drugs, they look alike. I remember there's a time we asked a child to buy, maybe, I can't remember, but there are two drugs that look similar, but one is for psychiatric disorder and one is for maybe something like allergy and all that, but the name sounds similar. So these people just gave the wrong one, because the fact they don't have the other one, just take this one. Don't fall into that trap at all. It's one of the most dangerous things, and it's because our pharmacy is not well regulated in Nigeria. It's very sad. I know NAFDAC is working hard, but people do a lot of bad things. Ideally, every pharmacy should have a pharmacist in-house because a pharmacist is not just a drug seller. A pharmacist is a professional, like a pediatrician, like a doctor, very well trained professionals who will know. Even when doctors write drugs and there's a problem, the pharmacist will know and will call the doctor and say, are you sure this is what you want or this and that? But some of the people you are going to, they are salespeople and they are interested in just selling the drugs. A good pharmacist will not even sell an antibiotic to you without a doctor prescription. These are things that should not even be in the domain of people. So what your doctor writes is what the pharmacist must display. If they don't have it, they will be the ones to call the doctor and say, we don't have this. Can we give this? And the doctor still has to write that they should give the right thing, because drugs are poisons. You can't afford to give the wrong drugs. Can be very dangerous. So please take note of that. I think I'm just going to do a talk on all this drug issue. Shiva girl saying, good evening, my child of 1 year stool after every feed in a day. She can pull up to 4 times, but it's not a loose stool. Some people do that. There's nothing wrong with that. As long as the stools are normal, it is what we call gastrocolic reflex. So each time they eat, there's a kind of wave of what we call peristalsis, and they feel the urge to go to the toilet. Adults, you can control yourself, but children, they can't. So they will just go, but their stools will be normal. It's not the food they are eating that they are passing out. It's the one they've eaten before that has digested, that has been absorbed, and the leftover that has been stored. That's what they are passing. So don't think it's the food the child is eating now. That one's still going to take like several hours before it gets to that rectum. So it's nothing to worry about. We don't need to worry. Your 1 year old is running temperature. Is it the same child? Yeah, the same child. Running temperature Friday 9 and Saturday 9. But since then, she hasn't run temperature. What is the temperature? Did you measure it? A lot of mothers say my baby is running temperature. When they measure the temperature, it's 37.2, it's 37.3. That's not temperature. That is normal temperature. So please, you should all have digital thermometers at home. If your child is running temperature, what I want to hear is how many degrees. 37, no. he's 38, oh, he's 39. That's what we should be talking out at this level, not just running temperature, because your hand is not a thermometer. Sometimes you feel your child, oh, my child is warm, but you go grab your thermometer, the thermometer is reading normal. So there's nothing wrong with the child. So before I forget the thermometer, measure the temperature, and then I will let you know whether I should worry or not. Do you have to take her to the hospital? She has cough and catarrh. Taking a child to the hospital is always your decision. So if you are worried enough, take your child to the hospital. We are always happy to see you. If you come and we don't have any concern, we'll tell you no problem, go back home. But nobody will ever say don't take a child to the hospital if you are worried. The fact that you are worried is enough reason to come to see a doctor, and the doctor just telling you, oh, there's nothing to worry about. It's also treatment. All right, it's treatment as well. So at least all your fear and anxiety will go because you've seen a pediatrician or a doctor and we've told you there's nothing to worry about. So if you ever think, should I take my child to the hospital? Go, there's no problem. And even if the doctor is not worried, they are not going to get upset with you. I know some of my colleagues get upset. If you go to the hospital, most of the time, at least we will still tell you not to worry. We would rather you come to the hospital than for you not to come on time and then we want to blame you. So see the doctors. Somebody says, can you recommend any speech? There are a lot of speech therapists in Lagos. So go to Google, type speech therapists in Lagos. They will come up and then you can go to the one that is close to you. So I don't recommend any particular one, to be honest. Somebody said, with these two tests and they show her for amoxicillin, who had to do these two tests? Is it a doctor that had to do these two tests, or did you go and do it by yourself? So one thing people do in Nigeria that is very wrong, which we have not always addressed, is parents thinking their child is sick, and instead of going to see a doctor first, they just go to the lab, and then they will do this test by themselves, do that test by themselves, and then they now look for who is going to interpret or who is going to prescribe the drugs. That is wrong. That is putting the cat, no, is it they putting the horse before the cat or the cat before the horse? I'm always getting it confused. Anyway, you know what I'm talking about. When your child is sick, please don't go to the lab. Don't. It doesn't matter what you think. It doesn't matter that each time you go to the hospital, that's the lab that the test doctor always recommend. Doesn't matter, no. When your child is sick, you go see a doctor first. That's the right thing to do. When you finish seeing the doctor will decide whether your baby needs a test or not, and what test your child needs to have done. And when the test is done, please take the test back to the doctor. Don't try to interpret it yourself. Take the test back to the doctor. The doctor will be the one to interpret the test and treat. We don't treat tests, we treat children. You people don't get that. Sometimes we get some results and we don't even believe that result. Sometimes we get some result, we think that result is wrong. But if you don't, if you don't do that, if you don't go to a doctor, you will just think, oh, my child has done 2 tests, I must give antibiotics. No. If your child has diarrhea, I don't care what bacteria you grow in the stool. If the child doesn't have any blood or anything in the stool, I'm not going to give any antibiotics. Okay? Because the stool area, there are a lot of bacteria that are there on a normal day. That is the job of a doctor to interpret. Okay, because we know that if you take urine, some of you, there's a way we take urine culture for lab. If you don't take it properly, you are going to grow something. That doesn't mean your child has a urinary tract infection. So this is why a doctor must see the child first. A doctor must interpret the lab test in clinical context. And that's why many of you send me your results online on our Facebook group. We can't interpret. I don't know the clinical context of your child. I don't treat results. I don't believe every result given to me. I treat the child in front of me. So the result is to help the doctor. In other words, what you're already thinking, the result may help you confirm it and maybe give you more information, but no, we start from the clinical, what is wrong with the child, what our own clinical observation, examination, our diagnosis is. So the test is what we call ancillary. It's an addition. It's to help us. We don't go from test to the child. We go from the child to the test if we think it's necessary. So don't form the habit of going to the lab, doing tests without seeing a doctor first. It's wrong. And when you see the test, don't jump the queue and say, okay, I want to decide what to do. No, go back to your doctor. Don't go to another doctor. Go back to the same doctor, because like what I've just explained now, there are scenarios. So if I've seen a child that is looking like this, and then I see a result that is going, the other way around, I will look at it again. Sometimes we repeat blood tests. Sometimes we see the child is looking so yellow. Oh, I think this child has severe jaundice, and we see a blood result that tells us there's no jaundice. We know that this is wrong. We may want to do it again. Sometimes we send the same test to 2 different labs. I'm just telling you that the lab are not like oracles. They are not God. They are human dependent. There are lots of errors that can happen in the lab. They are interpreted based on clinical information we give. So, and we have to also interpret them based on the clinical information we have. So if they don't match, we may discard the lab results and go for what we think is right with the child. And so that is why it is a dangerous practice to interpret your test by yourself and treat yourself. Don't. I know that healthcare can be expensive, but at least go to a government hospital. At least they will do it cheaper there. So please, those are very important information. All right, our time is gone. I'm going to round up now. Oh my goodness, I still have so many questions on Facebook. Okay, no. All right. So I'll take the last few questions on Facebook, then we'll round up for today. All right. I think I've answered this one. Okay, I've answered Glory's question. Ndube to say, I have a big girl of 2 years. She can read ABC 1 to 20, call mommy, daddy, da. So what are you worried about her? But she needs something. You can't hear her clearly. Do I need to be worried? Well, I can't decide whether you have to be worried or not, but as a mom, you will know, your 2-year-old, you know other 2 years olds around you. That's how to actually know, is your child, do you think your child is behaving like every other 2-year-old around you, or your child is different? That is the easiest way to know. So if your child is not clear, so a lot of you go by, oh, my child can read ABC, my child can read 1 to 20. Do you know what? We don't worry. We are not interested in that, because that is what we call rote learning. The child is only regurgitating back what the child has heard other people say. We are more interested in this, what the child says spontaneously by himself or herself. And right now, all you told me now is that your baby can say mommy and daddy. That is not enough for a 2-year-old. I want to hear, what is this 2-year-old conversation like? Is this child combining words together? I know what the child can read ABC 1 to 100. No. What if this child wants bread or food or wants to go to wee? Can the child have that info? Can the child communicate that to you? That is what is important. So it is not what they've had or cram into their head. It is what, if the child knows A for apple and all that, but when the child wants an apple, can the child say, mommy, apple? That is a conversation, meaningful use of words. So that child knows I want an apple and can say, mommy, apple. So you know that child means I want an apple. That is more relevant to me than the child who can say A for apple, B for ball, and all that. No. If the child wants to play with ball, can the child ask for a ball? So that is what we call context use of words. The child is using that word meaningfully. So that is what you need to think about. So if you're worried the child is not doing that, see a speech therapist. Let them examine the child or evaluate the child and tell you what to do. Somebody said, can cold water affect the baby? No. You can drink cold water as a nursing mother. It doesn't affect your baby. It's normal for a 6-month-old to develop breast bulbs. Most babies have breasts. This is the effect of their mother's hormones. It's nothing to worry about. Don't press. Don't massage. Just leave it alone. Leave it alone. That's all. It will go down by itself over time. Final question. He plays with other children. Is pointing. Okay, I guess this is somebody that's asked an earlier question. If you are not worried, no need to worry. If you're not worried, I won't be worried. But if you're worried, just see the expert. All right. I think that's all the questions. I hope I didn't miss anybody questions out. Okay, I think I've answered all the questions. So thank you so much for joining me today. If you still have any questions about the health of your children, you can always go to Ask the Paediatrician Facebook group. Unfortunately, we can't do question and answer on Instagram for various reasons. Instagram is managed by somebody who is not a medical person, so we are not online 24/7. So, but Facebook has that platform in which the questions can be kept somewhere until the person comes online. Instagram is not like that. So please go to our Facebook group. Some of you say you don't do Facebook. Unfortunately, we have only that platform for now, unless you want to do a private consultation on our WhatsApp, which is not free, because some of you still come to WhatsApp and expect us to do it for free. It's not. So, but Facebook is free. You can put your questions there, and it's still the same way we will answer your questions. And we are there 24/7, Monday to Saturdays. On Thursday, I'll be doing a presentation on, today is actually the World Hemophilia Day. Hemophilia is a condition where children have deficiency or what we call blood clotting factors, and they tend to bleed. Any little cut, they can bleed a lot, they can bleed to death. So it's today's the day we celebrate that World Hemophilia Day. Luckily, we have what we call those clotting factors that we can give to the children, but we need to know, we need to recognize them on time so that we can treat them. So this week I'll be talking about hemophilia. It's not very common. It's very common in boys, not girls. For once, girls are lucky, but we'll talk about it. And then, so watch out for that on Thursday. You can listen on Ask Dr. Gbemi podcast, our YouTube channel, our Facebook page, or Facebook group. It's not available on Instagram, unfortunately, but you can listen to it on all those other platforms. So if you have any questions, feel free to post on our Facebook group Mondays to Saturdays, and I'll be there to answer your question. Thank you so much, and have a wonderful evening. Just bye from me for now. Bye.